Thanks for joining us, everyone, and good afternoon. Appreciate you joining us for the Preparing to Pilot at a Healthcare Organization session here today. My name is Danielle Braun-Carlin. I am the Program Manager for Future of Health at Communitech. So I want to first off thank you all for your engagement and support of the program as we advance toward our solution showcase next week on the 13th. So if you don't have that in your calendar yet, make sure that it is penciled in for 11:30 a.m. Eastern Time on December 13th. So now the reason that we're all here today, as you know, conducting a pilot with a healthcare organization can be a great opportunity for your business, but the process is also complex and really challenging to navigate.
Oh, you're on mute, Danielle.
Okay, well, good to know. I will restart. Thank you, Shannon.
No problem.
Okay, good afternoon, everyone, and thank you for joining us for the Preparing to Pilot at a Healthcare Organization session. My name is Danielle Braun-Carlin. I am the Program Manager for Future of Health at Communitech. So thank you all for your engagement and support of this program as we are advancing toward our solution showcase next week. So if you don't have that event scheduled in your calendar yet, make sure that it is penciled in for 11:30 a.m. Eastern Time on December 13th. So now for the reason we're all here today, as you know, conducting a pilot with a healthcare organization can be a great opportunity for your business, but the process is also complex and really challenging to navigate. So thankfully, our friends at EY have been incredibly generous with their support of Future of Health, and they agreed to share their expertise in healthcare pilots and procurement in leading this session for all of you today. So without further ado, it is my pleasure to introduce all of you to Shannon MacDonald. Shannon is a partner with EY, and she's also the senior advisor. So she is the lead in digital health practice at EY. So thank you for your time today, Shannon, and over to you.
Thanks very much, Danielle. It's a pleasure to be here, and we're really happy at EY to support this program, Future of Health, that you have. We have today we're going to have three panelists join us, and we're going to have a great discussion about how to help startup organizations understand and connect with the healthcare system. So there are a good representation here. There's Doris Grant, who's from Halifax, Nova Scotia, and I'll get each of them to introduce themselves in a second. But Doris is on screen from Halifax, and we have Young Lee from Toronto, from North York General Hospital, and Sam Maud is here as well from Victoria, BC. Sam is a partner of mine at EY, but he, before, not too many months ago, was a founder himself. And so he went from founder to partner, which is a little bit of a different route than what we're going to hear from Doris and Young. So without further ado, I am going to toss a double question out to the three panelists. First of all, I'd like them to tell you a little bit more about themselves and how they connect with the startup community. And we're going to talk a lot about what should you consider when working with a healthcare organization, but they're going to give you their one favorite to kick off. So Doris, if you could start, introduce yourself and tell them the one thing that you would say to think about in working with healthcare organizations.
All right. Well, thank you, Shannon. And thank you so much for the opportunity to be here tonight. And I'm very excited to be able to listen and learn and share some of the things that we've been doing at Nova Scotia Health. As Shannon mentioned, my name is Doris Grant. I'm the Senior Director of Innovation at Nova Scotia Health, which is a provincial health authority in Nova Scotia. And I'll get into a little bit more about some of the programming and sort of the teams that we've set up to be able to help work with our startup companies. But I think for us, one of the biggest things, and that I'll put out to this team, is that our team, as we look at piloting, we want to work with partners and not vendors. And I think we can get into more details about that later, but that's an important one for us.
That's a great one. Great phrase to remember. All right, we'll head west to Young. And Young, if you could do the same thing, intro and your number one thing to think about.
Sure, thanks. Hi, good afternoon, everybody. Again, as Shannon said, my name's Young Lee. I'm the VP of Performance, Digital Health Innovation, and the CFO here at North York General. Got a fair bit of past experience and exposure in terms of the community community. Prior to this, I was at the local neighborhood hospital at Grand River in Kitchener. So have some exposure and experience with the community and a number of, while not directly many of you folks, many of your counterparts in the local ecosystem there. In terms of remarks around sort of what's important to know, I think it's important to be, I'll say, patient and flexible as I start working with sort of our sector. We are wired, the reality is, and for right or wrong, we are wired differently than you folks. And we have work to do to sort of shift our mindset and culture to be actually prepared, I think, to work with you folks more effectively, as opposed to our traditional means and mode of operating. So I'll get more into that later, I'm sure, but that's probably the one of the key things that I would sort of offer up as a starting point. We're just wired differently.
That's a good one. Thanks, Young. All right, Sam Modge joining us from Victoria, BC.
Victoria, BC. Hi, everyone. I'm Sam, and as Shannon kindly introduced me, I'm a new partner at EY, joined in 5 months ago. Before that, I was a CEO and co-founder of a company called Freshworks Studio. We were a custom application development firm. We grew the company to 100 employees, and we got acquired by EY. As would happen to any entrepreneur, today I'm actually in a session here, and I couldn't find a spot to sit and just have this meeting. So I'm in my car. This is the quietest spot I could find. Bring my iPhone and hopefully able to contribute meaningfully to this conversation. I'm super excited to be here. And to the question posed, I couldn't agree more with what has already been said. What I would also just add to the conversation is that when working with healthcare, it's important to note the level of empathy needed to work in this space. As entrepreneurs, founders, we are just geared to make progress and change things. And sometimes we forget the people, the staff, the stakeholders we are dealing with, and we are working in a highly empathetic political space, and it takes time. So that would be one thing that I've learned in the last few years is exercising patience, empathy when working in healthcare.
Very good. And Sam, you are the most professional car video person I have ever Zoomed with or Teamsed with. So well done. All right, so we have various questions that we thought about for the panel, but we are very happy to take questions from the group as well. So we'll monitor questions from the group. Please just type them in the chat. At the end, we'll go, on camera, raise hands, that sort of thing as well. So lots of different ways to get our attention to make sure we're answering your questions. But I'll get started with some of the ones I have, and you are very welcome to chime in and either drill in further or redirect me if you'd like to see something answered along the way. So we'll start, and maybe Young, I'll go to you next on this one. Just looking at things from, and you touched on this a bit, so it'll be a chance to drill in on the internal processes that exist in organizations like a hospital, and what do startups need to be conscious of in relation to that, the related procurement policies that obviously create that. And I know sometimes people call you to, chat about it. Who is the right person to go to and talk about that and understand it better? So kind of a multi-part question there, Young, but if you wouldn't mind talking around that.
Yeah, okay, no, thanks, Shannon. So, I'll and if I miss anything, please just remind me, and I'm happy to try to close the loop. There's a fair bit there to your point. So I think first and foremost, with whatever the solution is, the critical place to really start and to try to understand, and I know it's a bit of the chicken or the egg because you need to know where to start, but as a starting principle, you can call someone like me, but at the end of the day, understand who the end user would be and whose problem you're trying to solve. If you don't actually get the intention of that individual or individuals, then the idea won't go anywhere in an organization like ours. And so who's and to be perfectly frank, I may look at it from a financial lens point of view. I may look at it from a digital health innovation or technology perspective, but at the end of the day, if the person who ultimately uses it is a doctor, is a nurse, is another member of the clinical team, a member of the finance or whatever team, if those individuals aren't seeing the problem and understanding what you're trying to solve, then it doesn't matter for someone like me, ultimately, as a decision maker or a contract signer, or whatever the case may be. So, and I think everyone knows that, so what problem are you trying to solve? And then whose life are you trying to make easier by doing that? I think first and foremost is what I would offer up there. In terms of engaging an organization like ours, and I think it's really important, depending on the scope and nature of where you want to start and what jurisdiction you want to start in, there are variations in those rules in terms of how you start to work with a given provider, right? The reality is procurement may be similar principles, I would say, in the best interest of sort of public procurement, transparency, and fairness, but they do vary by jurisdiction. By that, I mean by province. And those sorts of things are largely sitting there by province. So, I think that's really important to be cognizant of and to do your homework as best as one can. And quite frankly, not be afraid to just ask the questions from that standpoint. How do you get to the right person? It's convoluted. A lot of hospitals, at least in Ontario, and it's a bit of a different structure. And I think it's really important you also understand the ecosystem that you're trying to sort of break into from a marketplace point of view. In Ontario, for example, we have still a fairly distributed and broad governance structure. And that is to say, each organization, such as a hospital, I have my own board that I'm accountable to, right? And as such, as an organization, we have our own processes and rules around procurement, et cetera, and so forth, research and ethics and so on that goes in, because again, depending on the solution, those are all the various factors that one needs to consider. But if you transplant that and then talk to, and Doris would certainly speak more about this, a province like Nova Scotia, which has gone to a single provincial health authority, it changes the dynamic in where you're going to, right? And the procurement structures, et cetera, and so forth, that transcend across the province and the various hospitals within that particular province. So really understand the fact that across this country, there are fundamentally 13 different health systems that exist today in terms of the 10 provinces and the territories. And as you sort of go down that piece as a starting point, that really then guides where it is you ultimately take your pursuit and engagement. So anyways, I'll stop there, Shannon, in the interest of the discussion a little bit. Happy to take any follow-up or anything if you have, or invite others to sort of comment.
All right, well, thanks, Young. And I think, Doris, Young's given you a perfect platform to build on in terms of what does a single health authority have the opportunity to do like you've done.
Yeah, no, thanks, Shannon, and thanks, Young. I think, where I'll start with that question is to really sort of introduce what we've built at Nova Scotia Health. So, we've been working on the Nova Scotia Health Innovation Hub for the past 2.5 years, but we only formally announced the establishment of the hub earlier this year. And it really is, sort of a virtual hub, if you will, that really brings all of our partners to the table, our patients, our families, because that is why we're doing what we're doing. It really is our startup community, our academics, and all of our, our clinical teams within Nova Scotia Health, as well as our private sector partners, right? Our goal is to really transform healthcare. And so we are, we always want to engage with companies who are going to help us solve problems, right? The idea behind the Nova Scotia Health Innovation Hub really is that we are the front door for partnerships for Nova Scotia and Nova Scotia Health, right? And that's different because, before I started at Nova Scotia Health, I worked with a lot of startups in our community that were always trying to figure out who was the right clinician, what was the right clinical team, should I talk to procurement, like where do you go? And Nova Scotia Health is about 30,000 people, big and wide, sort of from tip to tip of this province. And how is anyone on the outside supposed to do that. I can barely do it on the inside. And so, we really built the team, the people, and really focused on building and investing in business development, like a business development team to add to Nova Scotia Health. All new, like these are all new people with very strong BD backgrounds who, in some ways, act as navigators within the system. Who in cancer care do we need to speak to? Who in, cardiology? But we're also the team that works with the companies to be able to handle and do all of that diligence, right? So in terms of connecting with the teams within Nova Scotia and Nova Scotia Health, it would certainly be through the Nova Scotia Health Innovation Hub. We really want to continue to do much more work with our startup companies. The other thing I will say, and I feel like I'm very long-winded, right, is that we have been working with all of our corporate service teams within Nova Scotia Health, from IT to procurement to legal, to really help us sort of build and define sort of new processes that really enable our ability to work with our startup community and to be nimble and agile, which are words that you don't necessarily hear very often associated with a health authority. And so, we've been working again, sort of more and more with our startups. And we also work with multinationals that way. The bigger companies are also really interested in the ability to do pilots, or we call them test and try type of opportunities within Nova Scotia Health. So that's what we're here to do.
Excellent, thanks. And Sam, when you were at Freshworks, you had a lot of opportunity to contract with Western provinces on a few topics. And I wonder if you can share sort of a perspective from Western Canada in terms of how those health authorities or governments really interact with startup companies.
Yeah, I think the short answer, I'm seeing some questions in the chat, is people and entrepreneurs sort of trying to find a way in and penetrate. The short answer is connect with people like Doris and Young. These are the people who are making the difference. They know what it takes to work with a startup. If you reach out to someone in the government or in the healthcare space who already have a ton on their plate and are doing a lot of other things, and plus they are very risk averse, it's not going to fly. So the big thing that we followed were we were able to identify the champions, and we read the mandate letters, we read the notes, we read what their priorities are, and we went in prepared to talk about what those ministries, what those health authorities were actually looking for. Back in the days, for example, we knew virtual care was something the government was looking to spend. We came in with a prototype, also understanding the various legislations, privacy impact assessments that we needed to do to just make sure they understand that we understand government, we understand privacy, we understand the various compliances. In BC, we have PPDA. Overall, for health, we have HIPAA. So just making sure you have all those checks, sort of tick those boxes checked, and come in prepared, and do not waste their time. And make sure you identify the right innovators, the people who are looking to make a change. That made all the difference to us.
Thanks, Sam. There's a question from Sean in the chat, and the question is there a movement afoot in hospitals to clarify the approach pathway after clinical leadership has bought in? And I think that's building on a comment you made, Young, about making sure there is buy-in at the clinical side. And I think, Doris, you kind of told a little bit more about Nova Scotia's hub. After that, I think Nova Scotia has created a bit of a pathway for deployment of ideas that the clinicians have championed. But is there anything else that people like Young or Sam you're seeing on it? Is there a movement for a better approach? If a clinician came to you with an idea, is there something you can do with that, or is there still a bit of an uphill battle?
I can start. I think I don't know if it's uphill, sideways. It's still a work in progress for sure, to say the least. And I think, again, it really depends on the organization and where it's at that you're targeting or potentially we're looking to work with. I think, organizations that have more established sort of strategic focus on innovation, I think are better prepared to understand how they want to manage that pipeline. I'm struck by Sam's insight earlier in his introductory remarks around the fact that there's so much on the go right now. And so being able to catch someone's attention is first and foremost, that's a huge win. And number two, being able to see that through to something is another piece. But I think it really does vary in terms of how we manage the pipeline of demand and manage that pipeline of demand such that not only to sort of try to do something, but do something that actually is aligned to where the organization's focused on right now. And it's this notion of killing two birds with one stone. It's one thing to have a great idea and the better mousetrap, and we can get all kinds of buy-in and commitment. But if it doesn't actually fit the real foci of the day in an ideal world, it's very difficult to get through because there's already challenges in capacity at the organizational level to sort of spread the mindset and both the physical time and mental energy on something else if it doesn't fit, the 5, 6, 7 things that, that may be the priority of the day, number one. But to answer the question, there are organizations that are working on that. There's no question about it. I would say relative to Myra, they're a little bit further evolved in that thinking and what they want to do. And there are programs that have been established, right? I see in the chat the mention of Trillium Health Partners, right? And Grand River Hospital, my former organization, is part of a network and a program that's developed to help create some kind of a funnel in terms of activities and opportunities for such things. But again, they're very select, they're targeted, et cetera. And it's just building awareness of those kinds of opportunities as an initial entree point, as opposed to trying to, quite frankly, pick and choose at the provider level, because there's so many of us, it becomes very, very difficult and daunting to know where to start.
Thanks, Jan. I think I'm going to go to the next question on the chat. And I'm going to direct this one to Doris, because Doris, I've seen Nova Scotia do lots of very, advanced ways of getting funding. So this one's about what's a practical approach for getting funding for a trial or pilot of technology. And I know you've done that many times, but this one has a really interesting twist, because the technology would help people be healthy and out of hospital. And I don't know if that is something that you think sort of organizations like yours and Young would, know where funding was, and what's your reaction to that question?
Well, thanks, Shannon. I think that's exactly where we want to be, right? Like that is a space for hospital systems, because this is about keeping our populations healthy. And, I mentioned before, the Nova Scotia Health Innovation Hub, we have partners at the table, right? To be able to weigh in, to be able to move these great ideas forward. They're not all just from Nova Scotia Health. So, we do a lot of work with our government partners to be able to, again, really bring some great ideas forward. And, we're looking, and we have a lot of interest in keeping people in their homes. Like in Nova Scotia, we have a lot of rural communities. We have urban and rural, and we're always looking for ways for our citizens in Nova Scotia to be able to receive the care they need in their community. And, a lot of that is in their home. And so, we have evaluated technologies. We have launched and scaled technologies that do exactly that. But again, I think that this is exactly a space for a hospital system.
And is there a good path for funding, or just there isn't a secret sauce on that one?
Yeah, I think, there isn't necessarily a secret sauce. Like I think that, we work with partners to be able to help obtain funding. Some of the smaller pilots that we run within Nova Scotia Health, we support in collaboration with our partners. And so depending on sort of scope and scale, we take that on sort of ourselves. And, but again, there is no sort of one size fits all for that, I'm afraid.
And Sam, you I know have a lot of stories about kind of being scrappy, getting into some of these health organizations and governments and getting really interesting projects. How did you find funding?
Yeah, great question. I think first and foremost for us was to establish trust that we can be a trusted partner for the government and especially working for health authorities. And I think that goes back to Doris's comment on vendor versus partner. A vendor is just there sort of, I'm just generalizing it, but there to just make money and, get the contract signed and move on. Whereas a partner is there to make sure that program is successful, that the person is successful, that the whole initiative actually touches citizens and it makes an impact. That was our first and foremost concern, was to make sure, however big or small the engagement was, we were there to support it throughout. If that means doing some free work, we would be all in for that. If that means meeting outside and providing consulting help, again, in the spirit of helping, in the spirit of partnership, we would do that. And then doors would open automatically. If you do good work, I truly believe the doors will open automatically if you have a good heart. I'm going philosophical here, but in a way, we kept the most attention to making sure we're delivering and we are the trusted partner. And the funding sources started to open up. So we would partner with other larger organizations. If they have the procurement, we would find direct ways where ministries would be able to, put a competition out. Being agile and nimble, we were able to really compete and win those opportunities. In other cases, other vendors who are much larger would reach out to us to partner to get some of our secret sauce, if you can call it that. So once you become a trusted partner, you get invited to all kinds of opportunities, and then you actually will run out of people who can work on those. That's what we did.
Thanks, Sam. That's great. Now I have a trick question from Naveed. So I don't know if the three of you know the answer to this question, but what is the standard cyber insurance requirements from hospitals, and is this negotiable? Oh yes, young you would. CFO knows how to deal with this one.
Yeah, so the short answer is I would suggest to you there probably isn't a standard right now when you go hospital to hospital, to be perfectly frank. I think to the answer to the question, is it negotiable? I would hazard a guess to say, depending on who you speak to, whether it's the CFO, whether it's your CIO or your risk officer, it becomes very difficult to negotiate in this current climate. As it is from my perspective as a hospital, and I'm blessed enough to be part of an organization, we've been able to meet some added requirements to, quite frankly, secure and have underwritten additional cyber coverage. The reality is it's getting more and more expensive and, quite frankly, more and more challenging to actually even obtain that insurance as even a hospital. The marketplace is tightening up very greatly given sort of the risks and the payouts being seen in the cyberspace. So the notion of negotiating on that piece probably becomes very difficult given sort of the risk profile that we're certainly seeing on our end right now in this particular piece. And it's getting a lot of attention, to say the least, through our boards, et cetera, and so forth. So not the best answer, I'm sure, from the standpoint of those who are on the line here. But it's a high pressure point for us. So I have a hard time seeing the notion of negotiation on some of those pieces, given the risk points we're talking about.
And interesting, your comment about variation too, that makes it harder to navigate sometimes. I'm going to ask a question, again, just sort of go through the three panelists on a setting up a pilot for success. So if you're involved, you have an MVP, you get an opportunity to pilot with an organization. What do you see as key success factors for those pilots? What should people be trying to do to be, as Sam mentioned, that trusted, high-performing partner, the pilot that you're so proud of? And Doris, I'll start with you. What do startups really need to have ready and focus on to be successful in your eyes?
Well, I feel like Sam has been providing all of these great answers throughout our conversation. And Sam, I don't know if you can see me every time you speak, I'm like, yes. And so because you even spoke to a lot of the diligence that happens within the organization and the level of sophistication that the hospital requires from, from IMIT due diligence and ARB and, and privacy evaluations and everything. And I really think that, expecting, the hospital, even if we are running a pilot or, full scale deployment, all of that diligence needs to happen. It's going to take some time. And again, like within Nova Scotia Health, we have worked with our partners across the board to be able to streamline and prioritize innovation initiatives within the organization. But, I would also say that, we really do need our companies to sort of be patient, to recognize that all of this work is happening, and that to even work with us on developing, some sort of key metrics that we're going to look out for, as we work together, and also recognizing that we may want to pivot. Right. And if things aren't working as intended, or if we think that maybe the problem isn't quite as defined, we definitely want to have the opportunity to change course and to be able to pivot that.
Thanks, Doris. And Sam, anything you would add in terms of what to look for success, or what to really be mindful of to be considered successful?
Keeping it super simple and making decision making easy. That would mean, again, going back to the fundamentals, is understanding what's important, what's the priority, and doing the homework. If you, for example, if you want to say work with Nova Scotia Health, I'm sure if you go to their website, you go to their ministry mandate letters, you will find strategic elements there. A lot of entrepreneurs, and I'm including myself into that group, is we just want to run, we want to develop technology, we want to implement. I would say that's the easy part. And it took me a while to understand that actually building application, mental health app, virtual apps is actually very easy. You just, use SDKs. I was a developer myself, so I could code and program the app. What is difficult is to make sure it ties with the strategic priorities of the area that you're working with, and make it easy for them to engage with you. Do not get frustrated. Again, keep empathy as a principle in mind when engaging with public sector. They are all working very hard. I've got the opportunity to see that firsthand. From the outside, it seems it's very bureaucratic and it's slow, but when you actually are on the inside and you work with them, you understand how busy and political and just nasty it is inside. So be very empathetic, make the decision making easy for them to engage with you, be personable, always be helpful. Do not take anything personally. If what Doris is saying, if they have to make a pivot, understand why they would have to make a pivot. They might not have a time to explain to you why they wanted to make a pivot. So you just have to understand, sort of move on, do not take it personally, and just being valuable. So I know there's nothing tangible there. It's sort of all high level, but these are principles that you keep in mind. Doesn't matter if you're a product company or services company, will highly benefit you. That's my experience.
Thanks. Yeah, that's great, Sam. Thanks. Young, would you add anything to what Doris and Sam have said?
Yeah, I guess I'd just simply say the most successful pilots I've seen, whether it's in this entrepreneurial or startup phase or just in general, even from established entities, is the most successful ones or projects are the ones that actually have a clear end goal in mind in terms of an upfront sense of the indicators they hope to influence. All too often, I see these pilots where they try to figure out the measures after the fact. And so it is far easier when you know going into it, because then you design your pilot accordingly if you know what it is you're trying to sort of shift and adjust. And that's where that partnership comes in with the site that you're working with, because they can help sort of decipher, what are the key things that you hope to kind of do. And I think about a past experience, and I didn't sadly sort of live it through, but when I was at Grand River, we agreed to take on a relatively new organization to start up in the early days of the pandemic. around wearable technology that people, so we could actually track the traffic patterns and footprint of people in the hospital when we desperately in the early days wanted to understand where people were, the interactions, how long they're interacting with, et cetera, and so forth. In this era of trying to figure out just how close were people coming, were they spending time together, et cetera. And so we did that. But part of what I would say is that vendor, you can kind of see as we got through it, they really didn't understand the ins and outs, but they needed a partner who really kind of understood, could help them figure out the reality of what we were trying to do and understand the metrics we were hoping to influence up front to shape the scope and focus of the pilot, because we saw that it changed once we got into the inner workings of those pieces, even though we had common intention in that front. So I would say that's really key, but it goes back to the basics, right? When you're talking about healthcare, I would just say to you from a KPI point of view, what clinical and or operational value are you going to help realize? Get really clear about that piece. That can mean quote unquote efficiency, but it can also mean increased capacity. That is to be able to do more with the same.
Okay, thanks.
And then certainly if there's, you know, the sweet spot is where there's economic value as well.
Mm-hmm.
You know, again, I mean, those things don't change in a hospital and healthcare relative to any other business, quite frankly.
That's true. Yeah. I'm going to ask, oh yes, go ahead, Doris.
I'm sorry. I would just want to add one thing that we, with any pilot that we run, we wrap a pretty healthy evaluation framework around the pilot that we co-develop with the company, right? So we understand what the company is looking for from their evaluation. We may have other things that we need to add to that to be able to really sort of answer the hard questions for Nova Scotia Health, to be able to figure out sort of what's next. And so, you know, when we do the evaluation at the end of the pilot, you know, we share a lot of the information. We run sort of like we keep tabs on the evaluation as we go. So at the end, there are no surprises. We should know sort of all along how things are working. Some of our partners really appreciate that, but also understanding that sometimes like we have to agree on the KPIs before we start. And sometimes we have to pivot, but we always try to do that together.
Awesome. That's great. Now, this next question is a mental health question. And so I'll ask for a volunteer from one of the three of you. Given the current ongoing mental health crisis, how important are mental health solutions to bridge this service gap? Yes, Young.
I guess, I mean, it depends. And by that, I mean, notionally speaking, I think it's an important area of focus for us as an organization. And again, I'll just speak to an Ontario context. There's certainly lots of focus in terms of mental health supports going forward. I think this is where market intelligence becomes really, really important. It's best to try to do. You know, here in Ontario, as an example, there are a number of virtual and digital solution providers in that exact space that have come to the forefront and are already working in close partnership at the provincial level in terms of being availability for organizations to deploy in the mental health space. But I guess I would also say mental health is it's a broad term. So again, it's about having clarity and focus of what specifically are you looking to sort of develop possibly and bridge, because it's a pretty broad space, you know, whether it's teens and adolescents grappling with eating disorders, you know, that's a very different sort of population and solution base, if you will, relative to somebody who's dealing with generalized anxiety disorders and or bipolar or what have you the case may be, and or addiction for that matter, right? And so then the only other piece that I would suggest to you know, and this is the sad reality of our system as a whole, is some of these things in terms of access, these aren't necessarily universally covered, if you will. So there are still remain inequities in accessing those types of services, and it's just being mindful of those pieces as well in terms of the actual payment mechanisms around people using those solutions.
Okay, thanks, Young. Doris, there's a question asking for clarification about vendor versus partner in your earlier explanation. And I wonder maybe, I think some of your partnerships are quite creative. Could you just give a couple of examples of partner for you? And I think that might help clarify that comment.
Yeah. And I think Sam clarified it earlier.
Yes, Sam did add on to it. That's right.
And I appreciated that because it really does speak to some of the work that we do. So, and again, the problems that we're trying to solve. Again, there are other people within the organization like Nova Scotia Health whose job it is to procure solutions sort of on behalf of the organization, right? Like this is our supply chain, this is our provincial procurement teams, and that's not us, right? And so if you're looking to, if your goal is to be able to sell to Nova Scotia Health or respond to an RFP, the innovation team is not your team. However, when we look for and work with partners, right, we are trying to solve a problem and to be able to work with the clinical teams to be able to sort of evaluate, and we evaluate many we evaluate technological solutions every single day, but to really work with some of the companies to be able to pivot and to be able to really structure these pilots in a way that work for Nova Scotia Health. Now, one of the largest pilots, or we call them again our test and try opportunities, is a program that we launched in Nova Scotia almost 2 years ago called Virtual Care Nova Scotia. And so in that program, we're providing care virtually to our unattached patients in Nova Scotia. And it started out in 2 small zones of the province, which had the highest unattached rates. And so we were really working with, again, our patients and families, our providers, and our teams to be able to understand and define, again, what the problem is, what the success could look like of a pilot. And then we really went to the market and tried to identify sort of the solutions that were available out there that met our needs. And we evaluated many solutions, but we did find a solution that really worked for Nova Scotians. It really worked for our providers. It really worked for the whole program. Sort of was all co-developed, and right now we have scaled that pilot across Nova Scotia so that every patient in Nova Scotia who is unattached now has access to that program. But it's a lot of back and forth. It's like, our patients don't like this. Can you change that? And to really work with us on being able to, again, provide the solution that we need.
And it's a real win when your solution is scaled. And so to be accommodating to those early pilot asks, I think pays off for being well poised to scale. Sam, I'd like to get you on a question from Lorraine. And you have, you started in BC, but you now have a very good insight on the national landscape, especially coming in through UI and what you've seen. So Lorraine says, we've run a successful pilot and deployed our solution in BC. Would other provinces with a similar health system generally be more receptive than others with a very different system like Nova Scotia? What are your thoughts on that?
The short answer is yes. The other provinces, if they have the same system, they would be more interested. But I would say regardless, and Doris can keep me honest here, if a system has been deployed in a different province, other provinces, it's almost like a qualification for other provinces to sort of like trust you almost. That, hey, okay, if in British Columbia you have built this health gateway app, I want to learn more. I want to see how you engage with stakeholders. What were some of the learnings? Again, it goes back to the same principles of being helpful. So even if Nova Scotia, for example, in your case, Lauren, you identify it has different systems, but that shouldn't be a deterrence in case you're looking to work with them. It shouldn't be a deterrence in reaching out and say, hey, we have developed a POC or a pilot for BC. It's running well. These are the metrics. Although there are some differences in how it's implemented or the background or the technical architecture, but we believe X, Y, and Z would pique your interest. And you would be surprised how many times you will actually get a response if you have done something for another province And if you can connect them with another person from that province who can have a conversation with them about all the learnings. Yeah, just the fundamental is try to be helpful, try to not sell, try to provide information, try to provide knowledge, and you will see magic happening afterwards.
And Sam, would you say pilots vary in length as much as pilots vary in existence? Or is there a standard?
Yeah, there's no standard. Ministries and health authorities can decide to pivot. A minister can come in and say it's no longer needed. A mandate can change. Government can change. So a lot of things can change without any notice. So a pilot can go into production. A pilot can stay a pilot. So yeah, there's no real answer. But if you have a pilot, the success is that you have built a relationship. Now you just have to make sure you maintain and nurture and keep the relationship warm and use that across different provinces if you're looking to expand.
And Sam, I'm going to add a nuance onto that. I've heard a lot of startups get advice that they should just go to the US. We've talked a lot so far in this hour about the complexity of Canada. Can you make a pitch for Canada?
Definitely. That's what we have been trying to do for the last 4 or 5 years. So the way I look at the Canadian digital healthcare landscape is it's sort of on the cusp of, it's sort of on the inflection point where all the things, especially with the pandemic, people, citizens, government, they're all looking to make things more accessible, more digital. People just expect digital first. So all the companies who are involved in that space will feel and get more competition, but there will also be more opportunities to provide your products or services to the necessary health authorities. But again, I would constantly repeat myself, do not forget the fundamentals. You're dealing with people's health. You're dealing with a group which relies on empathy, and dealing with a group that is under a huge burden and under huge pressure with capacity. So keep those fundamentals in mind. But the Canadian healthcare system, especially when it comes to digital, is at a tipping point where these solutions would have to be implemented because the citizens are not just expecting it as status quo.
Okay, thanks very much. And I understand, I got a note that Sam's office car may become untenable in a couple moments. So if we lose you, Sam, thank you very much for the answers to the question that you've provided. It's been great having you on this panel. I have a question. No problem. Thank you. I have a question for Young. Our proof of concept requires significant hospital operational data to demonstrate value. Is there a recommended path to obtain the data to flag value? So not that they would want patient identifiers, but if you're looking for operational data, what's the best path?
Again, so I guess it really depends on the nature of what you're looking for specifically and the scope. But I would suggest to you, if one hasn't done this yet, it's important to do this. And it's fundamentally, any organization will look for a privacy impact assessment and a threat risk assessment and penetration test assessment. Those are fundamentals. And in any negotiation you go in around any potential exchange of data, that will be a question that is asked from a risk officer perspective and a data officer perspective in an organization like ours, or any for that matter. So you need to be able to prove sort of those basic elements and have that done, and appreciate that as an further investment that's required. But that's something that'll sort of come to be. And quite honestly, it ties back to the earlier question around cyber insurance. Those are just table stakes to be able to sort of prove those points out. But then, to be quite honest with you, again, it's like anything else, and it just speaks to where the sector is, right? There isn't each organization will sort of handle how it chooses to deal with that scenario based on its culture, risk tolerance, and comfort level in engaging in these kinds of activities. So, and just to put a practical lens, and I'm conscious of the fact that I must sound like I'm incredibly negative here and all the walls that we have. It's not my intention, but I'm just, in my head, I will be open and saying I grapple with it myself and how I break the mold in the world that I live in. And that is to say, it's a lot of work for us to share data with other hospitals, right? Or other home and community care service providers with whom we share patients. So if that's a difficult hurdle for us that we have to work through and takes time and effort, and that's in the interest of actually providing care, you can imagine what it means when we're asked the question of providing data, albeit anonymized, et cetera, and so forth, to a third party outside of our world for a different purpose entirely, right? Yeah. So therein lies, and I started my intro with about like we're just wired differently. That's part of what occupies my mind day to day, is how do we continue to shift the mindset and shift the risk tolerance factor to push the envelope and I would say redefine what it means to be successful in a pilot. Because for each of you, when you get to an MVP or what have you, you're going to get to that point, you will probably go through ups and downs to get to that place. Healthcare, generally speaking, doesn't have a high risk tolerance for quote unquote failures, right? You want the quick win and then the traditional way to build. But we don't necessarily embrace sort of the, uh-oh, we fell, even though we talk about it, to sort of what's next. And again, that's where it's, where I still come back to to come back to the question about data. Is it possible? Yes, but you got to find a party that's willing to sort of take that leap and have some of those checks and balances there to sort of as evidence to make the leap.
Very good. I'm going to take the next question to Doris, because Doris, your innovation hub sits in a part of the organization called Research, Innovation, and Discovery. And the next question is, would you agree that a clinical and research partnership is essential? And I know you've done a lot of bridging clinical and research. I don't know if you would have them, how you would feel about, is it essential that they're all in one partnership? What are your thoughts on that?
So good question, because again, I thank you for pointing out that we are part of the research, innovation, and discovery sort of team within Nova Scotia Health. And so, are the innovation team very involved with the research side of the house and all things sort of contracts and clinical trials and even, like I said, business development gets very involved in sort of the clinical trials with our pharma, with our med device companies and everything like that. But in terms of I think those things are important depending on the pilot. And when we do a pilot, this is how we position this, right? It's a clinical research type of position, and it really speaks to what we're going to do as partners, what you're going to do as partners, how we're going to hold each other accountable to that. And so really, I think it speaks to how we're going to work together as partners to be able to implement within Nova Scotia Health. But from an organizational perspective, we are completely aligned within our teams.
Excellent. I have one last question for both of you, and that's, what should founders know about a health system and the different user groups? So we mentioned at the beginning it was important to know users, but doctors versus administration versus research versus other types of clinical practice areas, at home, in hospital, what should be a good sensitive area that our startups take away from this call around? You have a lot of users that you deal with. So Doris, I'll go to you first and then Young.
All right, thanks, Shannon. So I think you're right. There are so many stakeholders within a health system. Young was right before. We're, for the most part, organizations like hospitals, we have a pretty low risk tolerance, and we don't like to see failure. We don't like to sort of see things come into the system and fail, right? Failure in patient care is never great. And so we're really trying to sort of change the narrative and really work within and all of our stakeholders to be able to align on purpose, align on messaging, and align on intent. And that is one of the jobs of the Nova Scotia Health Innovation Hub, is to bring all of those partners together to be able to, explain the opportunity and to really work through the opportunity so that all parties are comfortable. And that is a big task, from where we're talking. But again, for us, it is about working with the clinical leads to identify that clinical champion, to be able to ensure that all of our corporate service partners, like to our IT groups, it's just a technology, but to our physicians, it has the potential to be a cure, right? And so it's making sure that everyone has the common understanding of the different opportunities in front of us so that we can all collectively work towards implementation within the health system.
Excellent, thank you. And Young.
Yeah, and I guess this is part of the ongoing learning as you go through your respective journeys, but I would say take some time to kind of map out those various stakeholder groups and where their interests lie, and focus to sort of understand what that sweet spot is as you try to thread that needle. And by that, I mean, a clinician's going to have a desire to sort of improve patient care, improve the efficiency with what they work, the outcome for their patients, et cetera. But you contrast that with, quite frankly, on the IS side or the IT side, a desire to kind of minimize the number of interfaces we got to manage and sort of simplify the footprint and the vendor profile. There's competing interests, if you will, right? There's a movement afoot in our organization, example, to really kind of simplify our application landscape to the extent that's possible. And yet we have more and more things coming out in terms of their innovative solutions, et cetera, that can help. But that's more for the IS side to manage, if you will, and working with a given partner. So there are some tensions that exist. So it takes some time to kind of map those pieces out and understand where you're headed. And then the last thing I would just say is, be really clear as you map out those perspectives that you may have developed a better mousetrap. And that's important. But really try to be, as much as possible, really quantify or clarify how big a problem it is that's being solved. Right? That's two different things. Right. And in hopes that they all come together. But because something's better doesn't mean that problem that may necessarily be perceived as something that someone wants to necessarily fix relative to all the other things that are on their plate. So just an important distinction, I think, as you kind of map out the different stakeholders and understand the lenses through which they kind of view the world and the context in which they kind of look at things.
Excellent. Thank you. I wonder if you both would look at the chat as we leave. There's two last questions, which you may be able to drop a sentence onto if you have a second. But I do want to hold us very strict to time. I think that's an important part about holding a good panel is also being a time monitor. So I'm going to wrap it up here and just say, I can vouch very much for Doris and Young as being people who are absolutely breaking down barriers, creating new ways of working, and really coming from organizations that traditionally are very, well established in process, low tolerance and risk, often siloed, often difficult to work through. And I know that both of you have done tremendous effort to bridge the gap to the outside, to create bridges to the outside, and that your organizations have entry points now where people are welcome, where innovation is welcome. And I think that's just a real accomplishment. So thank you. I know you're both busy as a result of that work, and that you've taken an hour to come and share your stories with us is absolutely fantastic. Really appreciate both of your time. Thank you to everyone who's joined. I hope this has been a helpful insight into what's happening inside healthcare in Canada, and that there is variations across the country, and that you are welcome to make the connection. I loved Sam's advice that don't take it personally if it's hard. It's well-intentioned. So thanks for joining, and we'll see you next time.